Again, let me just say Andy Ross here. Keep those emails coming in. Andy Ross at Cox.net. That's ANDYROSS at COX.net. I love those questions. We are on KLAV radio. That's 1230 on the radio dial. Let's jump into the next question. I own a small business. What is the best way to go or to insure my family and our employees? Before I answer that question, let me just say a big hello to Justin and Christy. Hey guys, just wanted to say a big hello to you, friends of mine, and I just wanted to say hello. They're in town visiting, so a big hello to Justin and Christy, and we'll be talking soon. Hope you have a great day there, Justin, and you knock them dead. So let me answer that question. Again, I'm a small business. I own a small business. What's the best way to go to insure my family and our employees? The answer is, knee-jerk is group insurance. Group insurance is guarantee issue. You didn't tell me the size of the business. If it's small, I would lean towards individual policy. The pricing is much better, and with that said, you're better served saving the money. And what you can do is cover the insurance for the employees and then debit their pay monthly or every 2 weeks, and do it that way. So I advocate, if everybody's healthy and you don't have to go the group route, which is more expensive, get the individual. If there are pre-existing health conditions, somebody's uninsurable and you have to go the group route, so you will. That is guarantee issue. A good broker can help you with that. And then ultimately what you'll do is you'll fill out medical questionnaire. They'll handle all of it. You will need to prove you're a small business, tax ID, wage and quarterly tax. There's a few other things needed, but the key to the deal is that you do what's best. I have moved many of my groups and really divided them, and what I've done for my groups is I've put them on individual policies. It saved them a lot of money. Andy, can you explain max out of pocket? I wrote it down from last week's show and I do not understand it. Great question, appreciate that. The answer is that max out of pocket is your maximum exposure on your insurance policy. To me, that is the most important question. You can go to the doctor without health insurance and pay $50, $60, $70 and get your medication and you're done. The key to health insurance is, God forbid, you can be in the hospital, and you can run up a bill into the hundreds of thousands of dollars very quickly. So therefore, the most important thing is, what is your exposure, God forbid? Now, I always advocate not overpaying for insurance, but finding the balance between your max out of pocket and your premium, and being comfortable with the exposure. Because remember, every year it starts over. So since it starts over, I don't know if it makes sense. I never thought it did, to spend an extra $2,500 a year to save $2,500 in a given year. So let's summarize. Let's say over 10 years you spent $2,500 additional to reduce your deductible from $5,000 to $2,500. So what you just did is you spent $25,000 that could have gone towards your kid's education, and you've lined the pockets of the insurance company when you would have been better served to pocket that money, put that $25,000 into a savings account, and that more would have been, it would have been enough money to handle what I call that nickel and diming if, God forbid, something comes up in a given year where you are going to get hit with a $5,000 bill. So again, great question. I hope you understand it. Max out of pocket is your maximum exposure. That does include the coinsurance, and it does not include copays. What that means is that ultimately you are going to have that copay in place even if you reach your max out of pocket, which would be doctor visits, medication, preventative care, urgent care. Andy, should I get dental insurance? Maybe. Good question. Should you? I put a lot of people on dental insurance if it makes sense, if you're going to use it. The benefit is $1,000, but it's not a retail $1,000. So immediately when you get dental insurance, you can go and get cleanings, no charge. X-rays, no charge. Fillings, there's a waiting period. Bridge work, periodontal work, there's a waiting period up to 6 months to a year. Dental insurance is usually about $30 a month, so you're going to spend, let's call it $400 a year. But ultimately, if you go to the dentist like you should a couple of times a year, and you can put it to a calculator. I find that dental insurance saves my clients a lot of money. For kids, it's really a no-brainer with the cavities and the amount that it costs. If not, your other option is a discount dental plan. Email me if you're looking for a good, I can refer you. If you don't have insurance, they make you wait for dental or enroll at a specific time. What you could look at is, and I have people who call me all the time and say, Andy, I need major root canal. They want $4,000. I turn them onto a dental plan, and in turning them onto the dental plan discount, it saves them at least 50%. I use it for my children with orthodonture. So in the end, saving money and not paying retail as it pertains to dental is a meaningful part of my business. I love taking care of my clients and putting money in their pocket. We're going to be breaking for commercial message. We will be back in 60 seconds. Thank you very much.